Welcome to the In the Middle podcast, a podcast where we talk about every avenue of life because life really takes place in the middle, not the beginning, not the end. How do we navigate the middle?
Hey, welcome to In the Middle. Oh, It is the first episode with our first guest. I'm excited.
Yep.
I'm excited. Thanks for joining us this morning, afternoon, whenever it is for you, whatever part of the world it is. But yeah, okay.
Yeah.
Here we are.
Oh, awesome.
Let's get to know our guest and then let's just talk. Cool.
I'm cool, and I think this is the thing. This season, will be. We're going to have a guest in the room. We're going to have a guest in the room, and we have been spitballing things for too many episodes. Now, what does that look like for real people?
Yes.
Because we're not real people. We're fake people. What does it look like for real people who have real jobs, who have real life issues? What does it look like for them?
You can tell we don't do this often. We're off our game right now, guys.
Off our game.
Okay. Well, anyway.
So good. Yeah.
Everybody, tell us your name. Paul.
My name is Paul Cords.
Okay.
And I'm a member of Grace.
All right, great.
But that isn't really why we invited you
No,
on.
I'm here.
No.
So a little bit more. Talk to us about, I'm going to go this level. Marriage, family, kids, job.
Okay. Cool. Just like that. All right, so I'm married. This will be our 10-year wedding anniversary in August.
Congratulations,
And we
man.
were dating for 7 years before that, so we've been together a long time.
Wow.
You dated for 7 years?
Yeah. And 6.5 of it was distance.
Oh,
Wow.
Oh, okay.
And I was a
Okay, I was you was about to say, what took you so long, brother?
Okay.
Yeah. So once we got in the same place, didn't take long.
Okay.
But yeah, we're distance for that long. But now we've got 2 kids. I've got a son, Jace, who is 4.5, and then a daughter, Shay, just turned 3.
Nice.
So they're 17 months apart. I like to say Jace took us 6 months, and then Shay took us -2 months to get pregnant with those kids. So it all happened real quick. But yeah, and that's the family. And then I am a physical therapist by trade. So I spend my time in a outpatient rehab clinic. I'm a manual therapy certified orthopedic specialist and a dry needle certified specialist.
Wait, explain that a little bit more. What does
Religious
that
interventions.
mean? Yeah, what does that mean? Dry needle specialist, orthopedic, just a little bit more. Can you go into that?
So in the world of physical therapy, there's lots of different specialties that you can have. So I'm basically the general run-of-the-mill. If my back hurts, you go see this guy in physical therapy, that's me.
Okay.
But then within that, I like to use my hands on people. I like to do, work on tissues with my hands. I mobilize, I move it, I get things functional with my hands. That's a manual therapist.
Okay.
And then I also have this extra tool in my toolbox that is called dry needling, which is another soft tissue intervention to just make things move better. So I use that skill.
You can have like so many categories within physical therapy like that. Wow. So it's not just one lump sum when you go to school for that. It's one thing and then also
when you go to school, you get them all. And then when you come out of school, you pick which one you're going to spend your time in. And then you can specialize within that. But at school, you get the doctorate for all of it. Yeah.
They don't do that in the school, specialize in one? Like you, oh, wow.
You got to learn it all. Yep.
Okay.
You learn it all.
So dry needle, what is that? Explain that a little more.
It's kind of like acupuncture. Okay. But I didn't go to acupuncture school. I wasn't trained in Eastern medicine at all. So we use the same needles, but from a very different philosophy on how they work and what they do in your body.
Okay.
So it's, like I said, it's a soft tissue intervention, right? I'm trying to make a change to muscle tissues and tendons and sometimes nerves, and you just use these monofilament needles and you put them on the tissue that is affected and you circulate it, and it helps it move much better, and it helps things feel a little freer to do exercise.
Okay, I'm getting like these imagery here. So with dry needling, you put the needles in, and it's how does it cause the muscle to improve?
So a couple different ways. You're definitely giving this external stimulus to your body, right? So your body kind of responds and reacts in an inflammatory way, which comes with vasodilation, which comes with circulation. Like if you put a needle in somebody's body and it stays there, it turns red around it. That's your body trying to attack that needle. So that brings circulation to the area. But also when you poke a muscle, you can have a neurological response, like a trigger point. You have a muscle knot in your body. If I put a needle in that spot, it's going to have a neurological response of protection as well, which will get a very uniform contraction of that muscle. When I take the needle out, I get a uniform relaxation of that muscle, and the trigger point is no longer present. So I can get rid of trigger points, with the muscular response, but then it just feels better because it's circulated. So it's some pain relief, but it's mostly just functional circulation. I can move my shoulder better, I can move my neck better, I can move my back better when those things are circulated and moving as they should.
So just a question for me, for the rookie over here. For someone that has maybe knots in their back, would I come to you for this type of stuff?
You definitely could, yeah.
So physical therapy just isn't I hurt my back. If I just have knots and I'm stressed, some of this dry needling could help relieve those knots.
Yeah, and
do
then
you have clients like that?
Yeah, of course.
Okay.
But we would also dive into why you have those knots in the first place, and if there's other functional things that you can do to not get them to come back. Because you could just come and I can needle it and it feel good for, an hour. It's kind of like a massage. It feels good for like an hour.
Yeah.
Then you go back to your lifestyle, you go back to your stress level, and it just comes right back. So we would also talk about the other lifestyle management factors that you have at your disposal to not get them to come back.
So talking about those lifestyles, you said you're here at Grace, you've attended Grace. Tell me how you how is your faith involved in your work? Do conversations come about? Like how does that kind of stuff happen at work?
Yeah, I mean, that's a really good question, because that was a part of why I'm even in the profession to begin with, is because the way that I get to interact with people is seeing them in pain, seeing them in a horrible situation, or seeing them after a major surgery and they're in a really depressed state of being. A state of depression is just activity or thought processes less than you would have for a 2-week period of time. So people that have been hurt for years, people that have been in this kind of depressed state for a long time, I get to intervene, give them some hope, give them some things to do that's active, that usually make their bodies feel better and feel stronger and get them back to function.
Is it some faith-based, advice that you're giving some of these patients more than is it sometimes like, hey, I know you could be doing this, but if you choose to believe in this, you can get better. Do you understand what I'm trying to say? Is it some of that or no? Is it more?
When I get the opportunity, it totally is.
Oh.
For me, every time it is. For me, I mean, I'm laying on hands. Like, that's why I became a manual therapist.
Yeah.
Laying on of hands is something that I do with every patient. Whenever I get to do that, I'm praying over them.
Yeah.
I mean, being able to show love and care and consideration is a part of my faith. Being able to give them hope in their current situation is a part of my faith, whether it's pointing them to Jesus or just pointing them to some sort of light at the end of the tunnel. But when I can make it Jesus, it's that much more fun.
Okay, my dashboard's flashing everywhere.
I got so many too.
So you have patients, they come to you and you said they may have a physical condition, but there's a mental response. There's a depression related to a physical pain. So you literally find people who are stuck in the middle of something. They literally, their middle is, right now, I'm not where I was. I've had this moment, this pain, this surgery, this injury, and now I'm in the middle and I'm kind of like stuck. And they are hoping to get out of it. I know this is true. Sometimes you help them, but how much do they need to participate in getting unstuck? I know you can work your wonders with your hands.
Right.
But how much of it is on them to get out of that stuck in the middle moment?
Yeah.
And give some examples if you've got any.
Oh, I've got plenty.
Okay, go for it.
But that's one of the reasons why I didn't actually go to medical school and become a doctor. Is because the way that physical therapy can function in the system of somebody being stuck in a medical conundrum, if you will, or in that rut of the medical problem they're dealing with. The way that the physical therapist can intervene is truly giving them things to do, creating an independent source of function, getting them back to a quality of life that they expect to get back to, without necessarily talking about medication, without necessarily talking about injections, without necessarily talking about all this passive stuff. It's truly active intervention every single time. So how much of it is on the patient? Hopefully they can understand what they have to do and then get these things to do. 100% of it is on them to do it.
And
what's the example though? What's like an example?
So an example would be, let's take this guy that was in a car accident. And I got another one that just happened yesterday. But this guy was in a car accident. He's a buff dude, works out, lives a very active lifestyle, and can lift a ton of weight. He gets in an accident and he hurts his shoulder really bad, slap tear, all this stuff. Had to have a surgery to revise it. He was down for the count. Every medical provider he saw at the ER, they're talking about pain control. They're talking about imaging to see if they need a surgery. Even the surgeon gets to intervene, and that medical person barely even talks to the patient, especially if it's an emergency surgery. They see the image of this person, they see the story, and then they go to surgery and they repair the tissues. The kid is under the whole time, and that physician doesn't get to talk to them at all until maybe at the end when they're discharging. So then he has to sit in a sling for 4 to 6 weeks. He's not using his arm at all. Then he comes to see me. So this is already a situation of he's out of his element. He's not functioning like he wants to function. All he wants to do is get back to working out, and he has to sit and wait. And then I get to see him 2 or 3 times a week for the next 12 weeks. And we get to work through, what can you do right now? What can you do next week? What are the expectations of the next 6 for your function and activity? And we get to work him all the way back to his full level of function with exercise and working out after surgery.
Okay, but what happens when a patient is in the place where let's say they don't understand life in the middle, the reason for this podcast, and they're now on the place where, why did this happen to me? I'm a good person and this bad thing happened to me, and they can't shake the point of like wanting to be better. They're just in a state of depression almost. Good things or bad things happening to good people, and they have no understanding of in the middle. How do you walk them through that? How do they get out? How do they get that mental state out of okay, I mean, it's easy to walk into a physical therapy and be like, oh, I want to be better, but you got to get yourself to that position first. Yep. Sometimes if I'm it can just take you out if you're having a great life and you think that you're doing all the right things, and then now your life in the middle, and now you need to probably listen to this podcast of, how do you get them out of that state? How does faith, or how does your job, how do you approach that? Have you ever been in a situation where something good has happened to you or bad has happened to you, and because I know you to be a great person
first. Because I'm interested. First. You answer that.
I mean, no real examples are coming up with somebody that was in that. Well, no real examples are like just like that.
Yeah.
But again, what I believe Jesus does is he meets people where they are. And when I can be the person that is walking through week over week that recovery process with somebody, and they're stuck, they're truly stuck, the environment that we can set in a clinic, the environment that they can be excited to come to, but also a place where they can see small incremental wins, small incremental goals, gives them an opportunity to find some way, as one step at a time, getting out of that situation, that depression, but also giving them a glimmer of the function ahead, really talking about and spending time in conversation that's outside of that thought process on why did this happen to me, But again, if I can take it onto the church side of things, that intervention for me as an elder grace looks way different than for me as a physical therapist.
Yeah.
Because where I can meet somebody is different in those situations, if that makes sense.
Yeah.
As far as my intervention for that. But when we're talking about the actual belief on why do bad things happen to good people, there's got to be a reflection on the good in the situation. If I was taken out of this, what I thought was good, what's the purpose of me being out of that, what I thought was good? And now, since I'm not there, I characterize it as bad. If there's somebody that's over the universe and working in all ways and working in all things for our good, me being out of that situation that I thought was good is still a good place to be. And I'm here for a reason. And I'm stuck in this rut for a reason. And I'm rehabbing and I'm learning something that's a challenge. And I'm working through that challenge to gain something. There's going to be gain after that. And I guess that takes me to like a couple of physical therapists that I know that got taken out of sport, got taken out of what they thought was going to be their glory opportunity in life. I'm going to be a professional athlete. They got this injury. They went through the rehab process thinking that their life was over. And they came out of it on the other side as the best physical therapist to walk people through the same injury.
Wow. Mm-hmm. Wow. Mm-hmm.
So there's good to be seen, no matter how bad it may seem.
Well, I know this is going to be true because it is the case in every walk of life. You must see patients who come to you and you manipulate their situation and then you say, now go do this, and they don't. You must see people who you do all that you can do, but they just don't. Maybe it's expectation. This is good. You're going to get better. It's going to take you a year, and they go, oh, forget it. A year, I'm out. I want to be an Adonis in 6 weeks. Do you know what I mean? What do you mean, a year? So how do you handle that? You're treating people. You're trying to be patient with the patients. But just be honest with you about that. You're just unrealistic, or there's a lack of resiliency, because we talked about resilience before.
Yeah, totally, yeah.
They get stuck in the middle, and for some reason, they just don't. What do you see? Why does that happen? And how do you handle that? You must see these patients and go, I saw you 2 weeks ago, and you've done nothing that I've asked you to do. I can tell. And they may say they have, but yeah, how do you handle that? Trying to help people get unstuck, but they just don't.
Yeah. Yeah, I think the most success that I've had, that happens every day, by the way.
Oh, wow.
Really? Every day?
You want to punch people every day?
No. We as physical therapists expect a 33% compliance rating with what we give people. So 1/3 of what I tell people to do, they will. That's my expectation.
2/3?
1/3.
So 2/3 don't?
2/3 don't, yeah.
That's it? That's taught in school?
No, that's just...
that's
what we've come to find out.
That's the
kind
reality.
of an unwritten rule.
Yeah.
Okay.
So we've come to find out. So it happens every day.
Why is that?
Wow.
Because it's work, and sometimes painful, and sometimes, the comfort-seeking opportunity is that I just want to feel good now, but actually getting better takes some discomfort.
Okay, I'm going backwards here again. All right, so we're in this position where they're feeling this way, but again, I still want to sit on the bad things happening to good people. So how would you describe a person? Because I believe some of that is mental, that you can't get past that, you know? And when we're talking about in the middle, how can you relate that to your own life of them getting past that mental state first? So I think that's the biggest. Before saying that you're going to do something, you have to be mentally ready to do something. You can do all that you want, and if you continue to just, it never works out, I can just see you just giving up. How would you relate that to your own life? How could you give us any stories or just examples how you would relate getting past that mental struggle of bad things happening to good people, and getting to a place where now there's movement, and we can do our short sprints, and that season of pruning, all those type of things.
So first of all, I am an observer by nature. I don't know if I haven't said that yet. No. But being able, like, I'm in a situation where I'm seeing a lot of stories come through my doors, right? All my patients have a story. Every number has a name. Every name has a story. Every name matters to God. Whatever. However you say that at church. But
just for clarity,
every
number has a story. Every story has a name. Every name matters to God.
There it is.
So you're welcome.
Anyway,
you're welcome.
As a perspective observer of that, I've seen a lot of those stories. Like, personally, I can't say that I've been stuck in many ruts in my life. Very blessed in that regard. Very early on in my career pursuit did I know that physical therapy is where I was supposed to be, and it was going to be my mission field. So it's not my own type of rut that we can talk about with this. Okay. But, 2 patients come to mind. One that was in a rut and in a situation where the medical system got her stuck in the opioids and got her stuck in the pain management cycle of life, which usually leads to the really low socioeconomic status, Section 8 housing, and all these things that may lead to eventual homelessness. Right? She's in that rut. Okay. And then she didn't want to come to physical therapy, but she showed up anyway. And within 2 weeks, where she felt love and care and consideration, she heard some truth about what her body is capable of, because I did the testing and I showed her what her body was capable of, and told her that if you're in this much amount of pain, a lot of it is due to the confusion of your system, because you've been taking opioids for 8 years. And your neurological system has changed because of that. And she heard that and was like, that makes so much sense, because I don't even know what I feel anymore. And we went through the process then 2 weeks of learning how to even experience the world. What does pressure feel like? What does temperature feel like? What does this stretch feel like versus compression feel like? Like, we're just exploring her body as she's titrating off of opioids. She got all the way off of opioids in 30 days, and she was taking, an egregious amount. So anyway, she was finally off, and when she was done with that, She realized that she wasn't in pain the whole time. She didn't have physical pain. She was taking these medications because it was a cyclical process. And every single time she missed a dose, she had this influx of sensation that she thought was so bad, so she had to take another one. She was just stuck. But it only took 6 weeks to get her all the way off of the medication cycle, all the way through that rut that she was in. And then all of a sudden, she realizes that the world is her oyster. And she gets a different job. She's a manager of a warehouse. She meets a guy and gets married. I think she just had her kid yesterday. Like, she turned her entire life around.
Congratulations.
Because she got out of that rut.
Wow.
Right?
It was a mental thing.
Well, it was systemic.
It was a
She was was in this situation. Maybe early on she was in pain and she got given these drugs, and that's the epidemic that we're in. We're still not out of it. We're still in an opioid epidemic.
Oh yeah.
But that's a part of that epidemic. You know, I was given these medications that were supposed to get me out of pain and help, and then my system got hooked, and it's an addiction. But anyway, she's out of it. But all we had to do was really, I met her where she was at. I told her the truth about what I'm seeing in her body, and I'm meeting her there with care and consideration and love.
Yeah.
With no judgment, I hope.
Yeah.
And when she receives that, she now has this opportunity to make a change.
So here's the thing for me, because I know we've talked about it before. So you think the system is set up to treat the symptom, not diagnose the cause of the problem? We're just focused on, you've got pain, now you've no pain, based on the system is just patch that up rather than let's avoid this happening again.
Yeah, but the issue is, a majority of the time, if you can give the patch for a long enough period of time and that person stays relatively functional, it actually will help.
Okay.
Right? So take her out of that situation where she was really stuck.
Right.
Somebody that got in a car accident and got, you know, the dose that we're trying to give now, which is a 7-day dose of medication, they get over that initial pain, an insult of the injury, they can come out of that the other side and feel okay. You know, depending on the severity of their injury, their history with drug abuse and other things that they're talking about. So, I mean, there's all these things that are considered in the system. So I can't make the blanket statement over the whole system. But I will say that the research-driven pain interventions that we have are a nice little cover-up to the problem. And if you can cover that problem up and then stay functional, your body can do good things. But sometimes when you cover it up, your body doesn't know what to do to heal that tissue. You cover it up again chronically, and all of a sudden we have a bunch of dysfunction that shouldn't have happened in the first place.
So let me take a left turn here. We've heard a lot about your job, and that's great, and just kind of those experiences in the middle. I want to go to your personal life a little bit, if I don't mind. Yeah. Life is great. 2 kids, married, everything seems comfortable. Seems like really, really good right now. There's kind of, I haven't heard of anything, you know what I mean, any bombs or explosions. So would you say that life is just good and comfortable? What season of life are you in? How do you feel about that comfortability? Do you like it? What how's that go?
Yeah, Paul's like, I had a pain-free life.
Yeah, everything's just pain-free. You're just comfortable around here. Like, is comfortability great? Is that something we should all strive for? What do you, give me some personal.
No. Yeah, I mean, if anybody's had kids, you know it's not comfortable.
Amen.
You know, there's but there's a selflessness to that. You know, there's an opportunity to not be woe is me, to not, you know, and really rest on a sure foundation. I think that's where I take my seasons of life. You know, when you guys did that Seasons podcast.
Yeah.
I really like the imagery of a tree rooted near a river.
Yeah.
And it's a seasonless tree that's always bearing fruit. If I can always go to the river, which is now, it's my faith set, right? The promises of God, resting on the assurances that He has what's best for me in mind in every situation, and I'm planted near that, the fruit that comes from my life will continue, even through the pruning seasons, even through the coldest winter, even through the hottest summer. There's still fruit being born of that tree.
Yeah.
So that's where I try to plant myself in all seasons.
Okay.
How do you do that?
By being in church, by having a wife who's a believer, and at least believes the same thing that I do, that we can corroborate on those things when they are tough, by surrounding myself with people that can actually be there with me and support me in that, and having a good community, but also just believing God. I believe Him. And it's an unshakable belief.
Yep.
But it's not that people haven't tried. Yeah. It's not that I haven't been shaken myself, but that's where I want to plant myself. in those most difficult situations, I'm going to be close to the river.
So you would say even as like life has presented challenges, what I'm hearing is your mindset is just different. Your mindset is different than most. As life has presented challenges in the middle for you, you choose to look at what I would call the light at the end of the tunnel. You don't choose to stay in the gray or in the dark. You're looking at how do I get to this next short sprint? How do I get to this next season of life where I can now grow new fruits upon this tree? Is that kind of the way that your life outlook is? Would you agree with that?
Yep.
Okay. All right.
Yeah, and the fruit that's coming out of it is, if somebody else in that same rut and I'm in a rut, I want to find that person. We'll be in a rut together. Let's do this together.
Yeah. That's a great person to have around you in your circle, man, because
that's
misery loves company. You know what I mean? Like that people love to be down in the dumps with you. I think I just have another question. Sorry, I'm loving the guest thing. Like all the pressure's off of me to try to keep up with you, Des. How has the hallelujah word affected you? We talked. We had an episode about hallelujah, and I've just kind of wanted to know more about. But how has that word affected you and your walk in the middle? Like, how's that affected you?
And as he answers that, like those who don't know, like Paul's a musician.
Oh yeah,
like a singer, and we'll get into the whole different aspects of life in a minute. So our word for the year is hallelujah.
Yeah.
And here you are, a guy who gets to declare that hallelujah in song on a frequent basis. So that has a resonance. So how's that affected you?
I mean, you're preaching to the choir already, because hallelujah is a word that has been meaningful for a long time in everything, right? It's been a part of it. And I think that's the perspective too, being close to the river, being planted in that way, being a sure foundation. There's praise for every single thing. There's praise in blessings. There's praise in what seems like not a blessing. And it also goes back to, why do bad things happen to good people? That's a perspective already. If you have to ask that question, you're already in a perspective that God can make a bad thing happen to you. Or just God can allow a bad thing to happen to you. But as it stands, the world affects you, right? We are in the world and not of it, and the world affects you. That can seem bad, but when you are resting assured on God, there's good things that are going to come. And I rest on that. I praise for that. I say hallelujah even before it happens. I'll praise in advance. So hallelujah over everything, hallelujah in every single moment. That's a lifestyle, and you're preaching to the choir when you're preaching it.
Yeah. Talk to us a little bit about the impact that music and praise with music, what value that has in your life and how you live that out. Not everybody's a singer. You're a great singer, but how does that affect you?
Do you sing this?
What?
Yeah,
do you sing?
That's good lead worship.
Anyway.
He turns his mic up sometimes,
I'm not Paul.
He's singing.
I'm not Paul, I'm not you. I enjoy singing.
You enjoy
singing? I'm not saying I can sing.
We'll get into that
but
in another
I enjoy
episode.
Singing. I enjoy it.
Go ahead,
it doesn't
Paul.
mean I'm good at it, but I do enjoy it.
I just said I asked a question.
Anyway, it's not about me. It's about Paul.
Yeah,
right?
About Paul. Go for it.
I mean, music has been something. It's a familial thing for me. My mom is a very musical person, and her dad was a very musical person. He was a global missionary in the Lutheran Church, and he used to travel with a little pipe organ that he'd take everywhere with him. And he has a hymn in the hymnal. That's my grandfather. Never got to meet him because he died when my mom was 16.
Oh wow!
But the legacy of that has lived on. Her family's very musical. Her entire side, her brothers, both pastors, but both very musical. Her sister's very, very musical. So anyway, grew up with this underlying tone of there being a presence of music, and excellent music at that. Like very, very good musicians. But sung in a cherubs choir when I was 2 years old. Was in musicals when I was like 5, 6, 7 years old. All in the church. All the way through high school, just kept on singing. It's just been something that has been so consistently rooted in my activities that it's just a part of who I am. Like if you come to the clinic, I'm singing, and I can't stop. No matter what's playing, I'm just singing.
Is it your clinic?
Yeah, it's my clinic.
Oh yeah, so okay.
And
he's got the song here.
And but it's not that I want to stop. I don't want to. And that's an issue when I have health things going on that I should stop singing for a while, and I don't do it. But anyways, a part of the ability to get your heart out, a part of the ability to be able to express something in song, to me, is extremely meaningful. Because sometimes I can't write it, sometimes I can't say it, sometimes I can't even show you. I have to sing it. And there's a different emotability with song. There's a different, when you can put words to it, when you can put words with a group of people singing the same words to it and experience it with other people. I was in very, very good choirs in college, traveled the world with choirs, but the chamber group that we sang with, 36 voices, a cappella praise music, 8-part harmonies, locked in, like that kind of singing and song is glorious to me. And it's extremely excellent and beautiful.
Man.
So let me I think I'd like to do it with all of our guests. So here's Paul, who's a husband, a dad, a physical therapist who also runs the clinic, fully engaged in things, a musician who gets his heart out and cannot help it, serves, is on our leadership board of our church, actively involved in all that. You've got a few balls that you could be juggling in the air. Let's talk about priorities then. Because people find themselves in the middle, but I know that when you're in the middle, not everything stays in the same order at different times. So how do you prioritize? Maybe give us the good, bad, and the ugly of all of that. How you realize that I need to make some shifts. What shifts have you had to make in your young adult life so far when it comes to prioritizing and navigating what it is to live in the middle? Talk to us about that.
Let's assume that God is first. So let's, you know what I mean?
Yeah.
I just want to get practical.
But even get
God is
practical
first. So let's just assume that. So now,
safe assumption.
Safe assumption. Now let's talk about the rest of it. Sorry.
Safe assumption.
What is that? And give us as practical as you want, even with time.
Yeah. And I mean the ability for me to prioritize my wife has been seasonal, has been, every once in a while I think I'm doing a great job and she tells me I'm not. Every once in a while I know I'm doing a bad job and she says it's fine. So there's communication there with that prioritization and what it even means to have her as a priority, but she's definitely second on the list. And my kids right behind her. But I think our own parenting styles too, with prioritization of our kids and how they're in different stages of life, and when one of them needs a little bit of extra TLC and attention and time, and being able to hear that and listen to that and give them a day when they need a day with one of us, and understand that if it's an emotional thing, it's probably not going to be me that's going to spend that time with them because they need the love of their mother. When they need some extra things that are maybe going to be a distraction or something that gives them something that they know that they can do and accomplish and more of a functional thing, they'll have a day with dad. And really being aware of the needs of the children at this point in time. We've been very intentional about that. But that's a team effort. That's me and my wife. Because she spent some time and I spent some time. We kind of, we have the week set up where we're kind of trading off pickup, drop off duties, and there's just different time to get with both of us. But that's a priority in itself, and being able to talk through that with my wife sometimes gets low on the list on a week like this week where I'm doing 19 million things and, don't get to see them when they wake up, barely get to see them when they go to sleep for 6 days at a time. But that means that the intentionality of the weekend after is a time priority.
Yeah.
But anyway, it's all a conversation. And then, even at work, I think the priorities of the clinic, I've been doing the same thing for 8 years. So just kind of having a sense of what is needed, who is needed to be talking to, employee relations and things like that. There's definitely an inherent sense of confidence that I know what's best for the situation. But that comes from a lot of times when I didn't and had this overarching perspective on what can I learn from that. So anyway.
So you lead a staff team as well in the clinic?
Yeah,
how many people are
11.
under your authority?
11.
11. So you've got to manage those 11 people in addition. All right.
Yeah, and the culture of the clinic is supremely important to me. Because if we're in a good place, if we're in a good culture, if patients can walk into the door and know that it's a I don't know, pray over the establishment every day, walk circles around it, just making sure that it's covered as much as I can possibly cover it. But if they can feel that something good is happening here, they're way more likely to have a good experience in their recovery as well. And that has a lot to do with the culture of the clinic, and the health of my staff and the health of the people that are trying to help these people. So anyway, all that's on my mind. But as far as priorities go, I think being able to just have a real intention when I am physically present in a place, but also in the in-between times, you know, having some margin between activities to think about my wife and think about other people that I love, and reach out for Tess and have other prayer time that is in between all of these things definitely gives me an opportunity to reflect on what's needing attention, what the Lord needs me to put attention to.
So what you're saying is in your life, you almost intentionally create margin.
Very intentionally.
You're not just go. You create margin. You're able to
in every moment.
You're able to go and recover because you've created recovery.
Yeah.
Short sprints. You're able to go recover.
Correct. And
that
also preparation for that as well. You know, because I mean, if you just think about all the things you listed off that are kind of like things that have to be physically present for.
Yep.
My schedule for being physically present at places is made, right? It's like being able to have these activities it's in the calendar, it's made, I know where I'm going to be.
So what's a
preparation of that?
What's a pruning season like for you? What's a tough season like for you?
Yeah, have you had one, and how did it go?
You know, like, I really am hearing your mindset is so great, and I just wish, you know, I'm glad that I know you, but I wish more people had people like you around them with just the positivity to know that you'll make it through. Mm-hmm. But I think I want to hear the other side. Mm-hmm. What is a pruning season like for you? What is a tough season? What does that look like for Paul?
A tough season is when my physical body says you're doing too much. So pruning for that is saying no to some other activities.
That you would want to do.
Making sure that I set my sleep schedule differently, making sure that my activity modification, I'm not going to lift weights for a season because it's too stressful. I'm going to have seasons of stretching and more light activity on the side of things, which is sometimes not fun because I like to play volleyball too, and I really like to hit the ball hard at things and be agile enough to do that. And when my body says I can't do that, it's pretty frustrating.
Yeah.
But I understand, and I step back, and a lot of that comes back into more time in prayer and more time with people that have been there. So that's a pruning season for sure. But
wow. So you feel how you feel. Mm-hmm. You look at what you're doing and you go, okay, this isn't working. Mm-hmm. I need to make an adjustment.
Yeah, and hopefully I'm aware enough that I don't let it get too far, you know?
Yeah,
and I don't think it's gotten too far.
That's the thing. He's really listening to his body and his mind and his, you know, like, man, that's awesome. That's really awesome, Paul.
Yeah.
Man.
Really, but I can say, too, awesome. There's, you know, the career elements of that. I'm a very loyal person.
Yeah.
You know, even being at Grace, been at Grace for 10 years. And just like, I really like to pick a place and like get rooted there. Like that's kind of a part of my personality. So I'm a very loyal person. All of my relationships, even before my wife, are very long relationships. You know, I've worked at the same place since I graduated from PT school. I picked my profession at 14. I've stuck with it, and I'm not going to leave it. So very loyal as a person. So that makes pruning sometimes even harder. If I do have to let go of something that I've put roots into, super, super tough.
Yeah.
And I can honestly say that I know in the future, and I have this futuristic mindset that I'm going to be thankful for the changes in my career over the course of my career path, but I know that there's going to be difficult times that come with that because of my loyalty.
So on that, so what have been, if pruning is hard for you, making those cuts that you've had to be, just share with us maybe just one that comes to mind of a really difficult decision because it probably affected you emotionally, you know, not just physically. Have you? What would be an example of an emotional decision you found yourself? I have to make this change. Yeah. Share with us, with our listeners, what was that for you?
Well, I think it was the first church we found when we got to Phoenix was a church that we knew the lead pastor. He was an associate pastor of my church when I was a kid, so I knew the pastor. Was like, hey, let's try this church. We went. And really tried to establish what we thought was going to be a good community. I tried to get on worship team stuff, and they let me on. I was singing. We were doing all this stuff, but there was no sense that this is where we were supposed to be, as much as I wanted it to be, because I love this guy. But it was just so evident. It was just so clear that this wasn't going to be it. But it almost from the start. right? So that's the closest that comes to mind immediately, because I didn't have that prepared.
Yep.
But the closest that comes to mind immediately was something that already felt like it wasn't right to begin with. So, but I think part of that comes from, again, we're trying to be close to the stream. We're trying to discern where the Lord has us in every moment, for every circumstance and every opportunity. And, you know, hopefully we can really put the roots down where he has us and where he's supposed to have us. And then the pruning is from the branches, not the roots. So
you are separating from, because you're loyal. There's this guy who's the leader of that church, and you're like, oh, but I'm loyal to him. So to step away from that was what made it difficult. Yeah, it was moving away from him more necessarily. Okay, and that's not easy.
Not easy. That took us, I think it took us 4 months to actually take a step out.
Wow. Wow.
Yeah. But then we did. And then, you know, five trial churches later, we sat in the seat of grace, and the Lord says, you're supposed to be right here. You better not go anywhere. And then he did it again and again and again and again with different people, week after week, and he hasn't stopped since for 10 years. So
it's awesome.
It's awesome.
Man.
So good. So good. Is there anything you want to share?
Yeah.
In parting voices, you know what I mean? Hey, everybody,
on the way out.
Anything at all, about anything.
Yeah, I think being able to provide people with an eternal perspective, because we're talking about in the middle, where life happens in the middle, but your perspective and your pursuit of you know, accomplishing these things in life doesn't necessarily have to be. We live here, we live in this moment in the middle, but there's an eternity that we have to look forward to, and there's goals and aspirations that the Lord has put on our hearts that we have to chase after in life. And that kind of perspective coming from you guys, like talking about your favorite movies and talking about all this stuff that you like, you know, all these things that we could possibly expound upon, that we could look forward to in our life and get out of a rut, or just say, this is how I get through this middle season. Like, there's an eternal mindset that overarches ruts, that overarches the middle, that we do have a future to look forward to and hope for, that death is not the end, that even the worst thing we could possibly think of in this life, and dying, is a glorious opportunity because of what Jesus did.
Man, I'm really thankful to know you, Paul, and I'm glad our listeners got a chance to know you, and I hope this was really impactful for everyone. These episodes have always been, and this whole season 2 is just exciting. It just keeps going. We just keep bringing on new people and just walking through life in the middle. I'm going to end on a little bit of a lighter note, but speaking of movies, I think it's just appropriate that I find someone in this life on my team. So I would like to know your top 3 movies. Can we end on that? What is your top 3?
Your top 3 today.
Today. No, top Lifetime. We did Lifetime.
Okay.
We did all-time top 3.
All right.
Do you have it? Is it appropriate that we, is it 2 or is it 3? What
is it 1?
I mean,
let's start from 3 up, please.
It's definitely seasonal, and it's definitely, there's seasons of life. But I can say that I didn't realize how impactful this movie was to me in my young adolescence until I realized how much of my humor came from it.
Okay, number 3.
In college. So we'll put it at number 3.
Yeah.
But it's Dumb and Dumber.
Wow. Okay. Wow. Okay.
Yeah, you're not the
first. I've seen that.
You're not,
Our producer just got excited about that. My goodness, he got really ecstatic about it.
Okay, number 2.
Yeah, just quoted it yesterday.
Yeah.
Just happens all the time. Just keeps coming out. Number 2, I think, is a more recent one that got me really motivated. Finding motivation, finding something that's like, no matter the adversity, you can do what you set your mind to kind of movie.
Yeah.
It was Creed 3.
Wow, that's actually a good movie.
It was.
You probably haven't seen it, huh?
I've seen Creed 1 and Creed 2.
Wow, I can't.
I've not seen Creed 3
so
yet.
And the thing about Creed 3 that's different than the other ones, it's like they weren't trying to redo something.
I'm so sorry. He doesn't understand.
They weren't trying to, redo Rocky. They weren't trying to continue the storyline. It was truly the Creed. It was a Creed story, Creed through and through. There was a little bit of Apollo mixed in there, but like it was about this kid, and a really tough time.
Yeah.
And it was really well made. And I was watching that. I was watching by myself. I don't even remember what it was, but I had to be training for something, and the training wasn't going like I thought it should. And I watched that movie, and the next day, training turned around, picked it up.
Nice.
Let's go.
Number 1. Here we go.
Shoot.
Here we go.
Dude.
For this time right now, yeah.
But even I haven't watched a lot of movies.
Okay.
I don't know.
Okay.
You don't have a number one? So basically, Creed 3 is number one right now. Creed 3 is number one, and number 2 is Dumb and Dumber.
On that note, thank you so much for joining us on this podcast of In the Middle. We're excited to see you next Wednesday. Des, we good?
We're good. Every week, we're going to have a different guest.
Yeah.
From all different walks of life, because every single one of us finds ourselves in the middle. How do we navigate that middle? Thanks Paul.
Yep. Thank you so much for being here, man. This has been fantastic. And obviously, as well, leave us comments, write in, and we'll see you next week.
Subscribe, share it with people, let them know.
Here you go. Thanks, guys.
Thanks.